Are you seeing more of a trend of like just people just getting stuff fixed, not even doing the preventative care anymore, just kind of getting like the cosmetic stuff done just to kind of offset it? Could you kind of tell me a little bit about what you've seen?
Oh
And
me, that's a whole different little thing. But a lot of people think, I just want to, I want a pretty smile. I saw the baby get his teeth done, or such and such get their teeth done, but they don't recognize that yes, you can get your teeth done, but if your foundation is not solid, you're going to have bleeding and periodontal health, loose teeth, and cavities and things like that. So you have to get the foundation done first. I'm all about the cosmetic dentistry. I love doing I love doing veneers. I love teeth whitening. I love all that kind of stuff. But I'm not going to be a proponent of that if you don't have the preventative things. So if you're not getting your teeth clean on a regular basis, if you don't have good oral hygiene at home, it doesn't matter how much money you throw at me. I'm not going to do it. I'll send you up the street. Somebody will do it. I won't do it.
yeah, no, for sure.
Yeah. I won't do it.
Nah,
Not with my name on it.
yeah,
Walk
no,
around
it
with pretty
makes
white
sense.
teeth, but your gums are bleeding. Like, that's not good. And it's not just about your teeth, because the same bacteria in your mouth that causes the inflammation of your gums, it's the same thing that clogs arteries and things like that. People say they think that their mouth is just their mouth. No, your mouth is connected to your whole body, and that bacteria, that those things that are in your mouth gets in your bloodstream, goes to your heart, and different things like that. So it's not it's a whole health type of thing. So I'm into cosmetics, and cosmetics is great, but you got to make sure your foundation is good and preventative care is taken care of.
Yeah, definitely. Well, I got like a couple of random questions. One would be, I guess, like, I guess, how does substance abuse play a part in like the Tennessee dentistry organization? Because I know opioid use in Tennessee has definitely been on a rampant and quite growing, still growing, and it is still going on for sure. So how has that played a part? Because now when you go get your teeth done, they don't give you lower tabs no more. They just kind of give you ibuprofen and stuff.
Yes, they've really cracked down
Yeah.
on that. So honestly, with most of the time with tooth pain and tooth extraction, unless it was a very aggressive or rough extraction, you really don't need opiates anyway.
Okay.
And so I feel like it's a good thing that they're cracking down on things, because it starts with, oh, I had a surgery and they prescribed me opiates, and they think, okay, well, my doctor prescribed these to me, so this must be safe. This must be okay, and it's not safe. Things will say, take every 6 hours. Well, just because it says take it every 6 hours doesn't mean you need to take it every 6 hours. If you're not having any discomfort, you don't have any pain. So, what I like to do is, if I really don't prescribe opiates too much, unless the surgery is really, really bad. But, it's educating the patient, let them know most of the pain that comes from dental things is inflammatory in nature. So we need to prescribe you an anti-inflammatory, aka ibuprofen. You don't need an opioid, for that type of discomfort that you're having. So it's just about educating your patients and educating providers. We know better now, so we can do better now. We don't want to be contributing to, opioid misuse and things like that. So it's about education.
Definitely. So, well, I guess in the beginning of the opioid use, what do you think was the original? I guess we're going to use opioids for dentistry. What do you think, or what do you know of what caused that, or what started it, or?
Well, I think pressure from patients. So,
Okay.
There'll be patients. I know I've had several patients who are calling, well, doc, I'm in pain. I'm in pain. Give me more pain pills. Give me more, the pressure of patients putting on the doctor, or they'll, say, well, I'm going to give you a bad review because I'm in pain and you didn't give me anything to take care of my pain. Well, it comes from educating your patients and being strong and being the doctor and trained person that you are, to give them some other modalities to help with their discomfort, like, warm salt water rinses, ibuprofen, cold compress, different things like that to kind of help with their discomfort and managing your patients better. So the old adage was just, take out the teeth, give them the lower tab. I mean, that's just what the norm was. So
Yeah.
I guess recreating the norm is something that's going to help.
Yeah, definitely. And I guess since they've been kind of made the switch over, have you noticed a change yourself, and I guess from your previous experience, and then I guess maybe the education that you all have been doing, I guess your clients or patients are, when they come back for treatment, they're not asking for like the same thing that they may have asked for in the past, or they're kind of getting with the program
They
of what's
ask.
going on. Oh, they
No,
still
they
ask.
they ask,
Yes.
and they ask, and we educate, and
Okay.
They ask.
Yeah.
There's patients I've never even seen before that will call. So it's just, you have to just recognize, what's going on. They ask, and they probably will ask until Kingdom come. Or if I take out a tooth and then I hand them that 800 milligram ibuprofen prescription, that's all I'm gonna get. Yes, ma'am. Yes, sir. That's all you need. Just educate. And most of the time, once you educate people, they're like, oh, okay. So it just takes the time to just educate your patient. And staying strong on, well, my other doctor, well, that's not where we're at, So just educating and being strong, with your patients.
Yeah, no, definitely. No, I agree. And it's going to take some time, but I can definitely see a change, especially in Tennessee, because we have the highest rate of the opioid use, so hopefully it gets under control. That's that question, I guess, just in dentistry, just random questions. I guess with kids and then with the elderly, I guess with kids first, when should you even start to bring your kid to the dentist? Like what age?
When they get their first tooth.
First tooth come out.
When they
crack that first tooth.
When they crack their first tooth, that's recommended, but at least by age 1.
Age 1, okay.
And the reason for that is not when we bring them in when their first tooth cracked. They're normally 6 months or more. It's not to do any extensive dental work on them. It's to get them used to coming to the dentist. We want them to come in when there's nothing that's bad that's going to happen. Because what we don't want to do is traumatize the child.
Gotcha.
We don't want them to come in when it's too late and Johnny's got, several teeth that need some attention. And then their first experience with the dentist is something that's negative. You don't want that. So it's good to first come in when their tooth first comes in. And that's more so like an education appointment, getting Johnny used to being in the chair, hearing the sounds, the different things that are going on, and to educate the parent. Because a lot of parents don't know, not to let their children go to sleep with a bottle in their mouth of milk or a bottle of juice. Just kind of educating the parents, or letting them know, if Susie drops her passy, don't put your passy in your mouth to lick it because you're transferring your bacteria to your child's mouth. Let them know about nutritious foods, how to properly take care of their teeth. It's more so educating the parent and getting the child used to coming to the dentist without any fear.
Yeah, no, I got you. No, it makes total sense. So I guess now with the elderly, the dentistry back then is not the dentistry of today. A lot of the elderly only went to the dentist. I would say the elderly, maybe 60 and up range, I would say, would only go to the dentist if something was wrong. So I guess what is their experience now at the dentist compared to, because are they like, is it like what type of things do you see with the elderly? What kind of problems do you see with their?
I mean, you get a range of people. I know for my mother herself, she's not in her 60s. Mom, you're not in your 60s. She's in her 50s. But when she was growing up, you only went to the dentist when something was wrong. Yeah. So in her adulthood, when she got her own, job and got her insurance, she learned about the preventative sides of things. So I guess as you learn more now people are going for preventative and taking care of things. Now they're being educated and know better. So I guess as the time periods goes on, you get more education. So now, people in their 50s and 60s are coming for regular maintenance, just like, other people are now that have been educated, and there's dental insurance and access to care that more so that they didn't have coming back in the past.
Yeah. And do you see any particular common problem more so with the elderly?
Periodontal disease, gum disease.
Okay, that's what I was thinking. Okay.
Yeah.
Kind of explain what that is, I guess.
So, the periodontium is like your gums and the bone in your mouth that holds your teeth in your mouth.
Okay.
So as you get older and, different bacteria and things that are in your mouth, the bacteria eats away, you get bone loss. Okay. So once you get bone loss, remember the only purpose of bone in our mouth is to hold our teeth in your mouth. So if you lose bone, teeth start to get wiggly, gums get inflamed and puffy and bleeding. So a lot of the adult population has periodontal disease. So loose teeth, bleeding gums, different things like that. And remember, we talked about those same bacteria causing, being correlated with heart disease and stuff like that. So
you say a lot of the population, that means it's pretty much common when you see somebody, they probably got periodontal disease.
Mm-hmm. Especially if they've never, and especially if they don't go to the dentist on a regular basis, they're probably walking around with undiagnosed periodontal disease.
Okay, definitely.
Or at least gingivitis.
Yeah, that's interesting.